Hello all, let's talk about some of the Council Prometric Exam questions. Patient with type 1 diabetes mellitus is admitted in the hospital and below are the medication list. Which medication should be clarified with the physician? Sliding scale of hemalog, glargine 10 units subcutaneous, metformin PO and dextrose 50% ambule IV. So all these three are given for type 1 except this one metformin is given for type 2. So this one should be clarified with the physician. The published discoloration of the vaginal mucosa due to increased blood supply to the pelvic region during pregnancy is called Chadwick sign. 9 weeks pregnant woman had bleeding for several times. What could be the reason for this one out of the below? Ectopic pregnancy, normal during early weeks of pregnancy, hypovolemia, anemia. The correct answer is ectopic pregnancy. 28-year-old male is recovering from a moderate concussion following a motor vehicle accident that happened 2 weeks ago. He suddenly develops increased thirst and he urinates very large amount of dilute urine, and the specific gravity of the urine is 1.001 to 1.005. So he may have diabetes mellitus, diabetes insipidus, hypothyroidism, thyroid stroke. So the correct answer is diabetic insipidus, right? Because after MVA with large amount of urine and specific gravity low and then thirst. Unexpected cardiopulmonary adaptation experienced by most pregnant women are tachycardia, dyspnea at rest, progression of dependent edema, and shortness of breath on exertion. So the correct answer is shortness of breath on exertion. Nutrition planning for a newly pregnant woman of average height and weight is decrease of 200 calories per day, increase of 300 calories per day, increase of 500 calories per day, and maintenance of her present caloric intake. So the correct answer is increase of 300 calories per day. A pregnant woman has a traffic accident and she came to the emergency department during nursing assessment. The palpation from the nurse, the woman has acute pain and possible bleeding. Which of the following nursing diagnosis should the nurse expect? Abruptio placenta, pain. So what is the correct answer? Abruptio placenta. A woman patient had a molar pregnancy. What is the best advice from the nurse? Hysterectomy, not get pregnant again, get pregnant after a year, and tubal ligation. What is the correct answer? Get pregnant after a year. Thank you and see you in the next topic.